Dr. Mizuno, are you ready to pitch?
Yes, please.
Okay, so please give a warm welcome to her.
And thank you for giving me the opportunity to speak today. I'm Yu Mizuno, ophthalmologist in Hiroshima University Hospital. Today, I'd like to talk about our new approach to prevent people from blindness. $2.2 billion people are suffering from visual impairment in the world. 1 billion could have been prevented, and 19% can be treated even if in the terminal stage. That is the anterior segment part of eye disease, such as cataract or myopia. Let me show my outpatient yesterday. The first patient is 80-year-old man, and he has just finished his surgery for severe cataract, and he's so happy to recover his vision. The next patient is also 80-year-old man. He has glaucoma, one of the posterior segment part of eye disease. And when he came to my outpatient, the glaucoma is already in the terminal stage, and I can't help him to recover his vision. So posterior segment part of eye disease, such as glaucoma, diabetic retinopathy, or age-related macular disease, they have effective treatment now, but the treatment must be started at the early stage, and if not so, they will become blindness. But however, posterior segment part of the eye can only be observed by the ophthalmologist using specific lens and light. So you can never see posterior part of the eye using pen light. Let me talk more about posterior segment part of eye disease, for example, glaucoma. When the patient feels difficulty of vision, the glaucoma is already in the terminal stage, and starting treatment at this stage, they will become blindness. So currently, at least 10 million are being missed because of hard access to the ophthalmologist. So let me introduce about our new approach. We create the smartphone connected ocular fundus camera so that anyone, anywhere, easy and low cost to observe posterior segment part of the eye as the ocular fundus images. And we also create the system of remote diagnosis by the ophthalmologist and easy access to the ophthalmologist for treatment. So use our device and system. The patient can start treatment at the early stage to prevent blindness. And our device is quite simple design and no need for training. And we plan to start to use our device and system in Japan and Indonesia, one of the countries with the highest number of patients for undetected ocular fundus disease. And the medical cost only for ophthalmology is $8 billion in Japan and $80 billion in Indonesia for a year. And the number of the patients will become 2.5 times more in 20 years in Indonesia. This is our business plan. For example, in Indonesia, if the patient want to see the ophthalmologist, they couldn't go to the ophthalmologist directly. They have to go to the health center first because of the public health insurance system. And in health center, physicians or nurses are using pen light to check their eyes. Of course, they couldn't observe posterior segment part of the eye using pen light. If they want to check the posterior segment part of the eye, they have to use very big and expensive conventional ocular fundus camera. So we plan to sell our device instead of pen light or conventional ocular fundus camera. And we also plan to earn advertising fees by advertising our partner hospital that can provide diagnosis and treatment when we return the result back to the patients. This is a competitor analysis. The most major device is conventional ocular fundus camera. It can take clear ocular images, but big and expensive. And they already have portable or smartphone connected ocular fundus camera. They can also take clear ocular fundus images, but still expensive. And more than anything, they do not have the diagnosis by the ophthalmologist. Compared to them, our device is specialized in screening, so we can create it for low cost. And at the same time, we also create the system not only for taking ocular fundus images, but also for the diagnosis by the ophthalmologist and easy access to the ophthalmologist for treatment. We are now preparing to apply for patents. And we are also now preparing to do clinical trials for first investigation in this year. Let me introduce about my team. Yoshiaki Kyuchi is the ophthalmologist. He is the specialist for the glaucoma, and he's also the professor in our university hospital. And Hitoshi Tabuchi is the expert for the AI, and he's also the ophthalmologist. And Naoto Kume is the expert for the electronic health record. He led the Millennium Record project in Kyoto. And Kai Shimada is the expert for the business in Indonesia. He has been staying in Jakarta since 2019. And we are now looking for the contact for financial assistance and joint development. Please contact us. Thank you very much.
Thank you very much.